Hello, my name's Stephen Loyd. I'm the Chief Medical Officer here at Cedar Recovery. Our mission is to help solve the opioid crisis. We want to meet you where you are, no matter what, and help you feel better, get better, and stay better. The first part of feeling better is knowing how to properly take your medication. A lot of you have been getting medication off the street or taking it from other providers, and they never explain to you anything about how to properly take it. I see people taking it multiple times a day in little bits and pieces throughout the day, and that is not how to properly take any buprenorphine containing product. So when I talk about medication today, I'm talking about any of the trade names that involve the medication buprenorphine, which is the anti-craving medication you're being prescribed in our office visit today. Now, the trade names are Suboxone, Subutex, Zubsolv, Bunavail, or injectable Sublocade. Those are the brands, all of them containing buprenorphine, which is the medication that stops cravings and stops withdrawal syndromes for opioid pain medication, as well as heroin and illicit fentanyl. Now, medication has a really long half-life. Half-life means the time it takes half of it to get out of your body. So when I take a medication, my body starts trying to get rid of it right then. Okay, as soon as I take it, my body starts trying to get rid of it because it's a foreign substance. Okay, just like everything else, food, water, all that stuff, and you know the routes of administration. It's urine and it's defecation. Okay, so buprenorphine is the exact same. So as soon as you start taking it, as soon as you take it, your body starts trying to get rid of it. Now, half-life means the time it takes half of it to get out of your system. The buprenorphine containing products that we use have a half-life of more than 33 hours. That means if I take it this morning, tomorrow afternoon, half of it is still in my system. And with that dosing, that means it can actually last 2 days. And I'm sure a lot of you have already figured that out. So here's how to properly take the medication each time. I want you to get a drink of water, just enough to get your mouth wet, swish it around and swallow the water. That's just to get your mouth nice and moist. I want you to take the entire day's dose of medication all at one time. So if you're on 4 milligrams, 8 milligrams, or 16 milligrams, or 12 milligrams, I want you to take it all at once. Put the medication underneath your tongue after rinsing your mouth with water. Lean your head slightly forward like I am for 5 to 6 minutes and let the medication dissolve under your tongue. Don't swallow the medication and don't swallow saliva that's got the medication in it. The reason is if you swallow the medication, number one, it doesn't work. It only works if it's absorbed underneath your tongue. And number two is if you swallow it, there's a good chance that you can get an upset stomach or headache. I have patients all the time, oh, Dr. Loyd, I can't take Suboxone. Well, why is that? Well, when I take it, I get an upset stomach or I get a headache. I know immediately that my patient is taking their medication wrong. So now, after it's been dissolved for 5 or 6 minutes, whatever's left in your mouth, spit it out. Okay? Don't swallow the remainder of the medication. No nicotine or caffeine 15 minutes before you take the medication or 15 minutes after you take the medication. And when I say nicotine, that means cigarettes, that means smokeless tobacco products like I call it dip. All right, so smokeless tobacco or any vaping product 15 minutes before or 15 minutes after. When you use caffeine or nicotine within that amount of time of taking your medication, it speeds up the metabolism, it speeds up the breakdown of the medication, and so it doesn't last as long. So we want it to last as long as we possibly can, because the first step to you feeling better is to actually get rid of the withdrawal symptoms and to get rid of the cravings. Now that we have you feeling better, now we can start to talk about getting better and staying better, and that happens as a result of a meaningful relationship with a therapist and being engaged in therapy to help address some of the underlying issues that are driving addiction. And staying better is the same way, along with case management services that can help you with some of the things going on in your life, like housing issues or abuse issues in the home. So welcome to Cedar Recovery. We're honored to be a part of your path to recovery.